Hi, I'm Dr. Clay Williams, a board-certified urologist at UT Health East Texas in Tyler, Texas. I want to talk to you about the 5 things that you need to know about urge incontinence. Urge incontinence is pretty much what it sounds to be. It's the frequency and the urgency that you have to use the restroom. All urinary incontinence averages about 1 in 3 women, so that'd be the same thing with urge incontinence. Strong urgency and frequency, this desire to use the restroom. The key though is most of the time you feel like you haven't emptied your bladder because you're going to the restroom and non-stop. The symptoms of urge incontinence is pretty straightforward. It's exactly what it sounds like. It's this urgency to have to urinate, sometimes every hour, every 2 hours, but whatever the definition it is to you, is something that's very bothersome. You go to your family physician or urologist and you basically are telling them that you have this strong urge to urinate all the time. Wakes you up, every evening. Either way you look at it, it's something that is bothersome to you and it's a quality of life issue. So urge incontinence treatment for men and women are somewhat similar but also different, but the symptoms are obviously the same. The first line therapy for urge incontinence in both men and women would be some sort of medication that we call anticholinergics. But another treatment option is if you fail one of those medications, we can do what's called bladder Botox injection. And it's the same thing that you place in your face that paralyzes the muscles temporarily to get rid of the wrinkles. And it does the same thing in the bladder. Essentially, we're trying to paralyze a small amount of the muscles in the bladder so that you don't have that squeezing of the muscle, which is how we interpret urgency. So the Botox that we inject in the bladder with a very simple 1-minute procedure in the clinic may be a good option for you to help reduce the urgency and frequency both in men and women if you failed medication. And another therapy we can do is if that treatment does not work, we can do what's called a bladder pacemaker or an interstim therapy, whereby we put some test leads in your back and line them up with some small nerves in the lower back. It's not neurosurgery, it's all done right through the skin. And what we're trying to do is kind of reprogram those nerves that are going to and from the bladder with an electrostimulation that you cannot feel. It's not painful on a day-to-day basis. And that's a third-line treatment we can do if you fail medications and the bladder Botox injections.